Today's learning session, Crisis Text Line, the Local Experience. I'm Johanna Bergen, a co-lead on the Young Adult Services and Supports Learning Community, which is a learning community hosted by the TA Network, and I'll be moderating today's session. Thank you so much for joining us. We have a great presentation lined up for you. I want to welcome you not only to today's session, but also to the learning community that this is a part of. The Young Adult Services and Supports Learning Community brings together individuals who share a concern and passion for age-appropriate and appealing systems and supports for young adults. It provides a forum to discuss and learn together about important and emerging trends to create better outcomes during the transition into adulthood. The learning community convenes all stakeholders in partnership with young adults, learning together as we interact regularly. Our goal is that individuals and communities experience support and success while working towards sustainable, positive change. I'd like to welcome my co-presenters and partners on today's webinar and in this learning community effort. Gwen White serves as a co-lead in this learning community. Gwen, would you say hello and introduce yourself?
As Johanna said, I am the co-lead with Johanna. It's a great privilege on the learning community, and we're excited that you have all joined us today.
Thanks, Gwen, and thanks for modeling that we can get through a presentation about technology using the technology we have in front of us. If anyone has questions or if echoes happen to you, feel free to chat into the chat box and we're able to help support you through that. Awesome. Thanks for being here, Gwen, and thanks for helping with Q&A later during our session. This is the first of a series of learning sessions that will be offered throughout our learning community. We are striving to do a couple of things. We want to bring new, relevant content to you each month. Participants in our learning community are helping us identify and prioritize the topics that we're talking about. We also want to offer opportunities for peer-to-peer learning and really highlight really strong, effective work that's happening in the field in a way that allows you to think about how you might want to apply similar strategies in your own community. And we have a great example of that today. I am so glad to be joined by Laura Payne of the Ohio Department of Mental Health and Addiction Services. Laura is going to be presenting a little later in today's session on the great work happening with Crisis Text Line in Ohio. But Laura, I'd love for you to introduce yourself to everyone now.
Hello, this is Laura Payne. So I'm a researcher with the Bureau of Children and Families at the Ohio Department of Mental Health and Addiction Services, and I work with our partnership with the National Crisis Text Line. Thank you for having me.
Awesome. Yeah, thank you, Laura. So I get the honor of sneak previewing the slides, and you guys are in for a ton of great content today. So throughout the session, please feel free to type questions in for Gwen, Laura, or myself. We're happy to be of assistance to you today. And as today is really our first learning session, we also have the honor to be joined by one of our strong supporters and partners from SAMHSA's leadership. So I'd like to welcome Diane von Zimmer to join us today. Diane currently serves as the Deputy Chief Child, Adolescent, and Family Branch, Federal Center for Mental Health Services, Substance Abuse, and Mental Health Services Administration, the U.S. Department of Health and Human Services. And Diane, thanks for writing that all out for me, because if it had come to me in acronyms, I may have made a mistake. We're really glad to have Diane with us today. She's a nationally recognized leader with over 2 decades of experience in developing, implementing, administrating, and evaluating local, state, and national health and mental health programs designed to improve quality of life for those that we care the most about, children, adolescents, young adults, and their families. She's contributed to the research literature in many areas, including that of youth in transition to adulthood and other issues that are important to child and youth health and mental health. When Diane was asked what her mission is, she responded, "I am devoted to supporting communities and organizations in building effective systems of care for children, youth, young adults, and families. My approach is to blend policy, research, and practice to ensure that new directions are reflective of what is needed and what will work. Diane is going to help us kickstart our learning community by sharing a few words with you all today. Thank you so much, Diane.
Oh, thank you, Johanna. Good afternoon, everyone. As Johanna indicated, I'm Diane von Zimmer. I'm a member of the Young Adult Services and Supports Learning Community and will be on the calls to address any comments or questions you may have about SAMHSA, the Substance Abuse and Mental Health Services Administration. SAMHSA's strategic plan, which is available to you at www.samhsa.gov, provides a roadmap to carry out its vision and mission over the next 4 years. In order to achieve its mission, SAMHSA has identified 5 priority areas to better meet the behavioral health needs of individuals, families, communities, and service providers. Priority 2 talks about addressing serious mental illness and serious emotional disturbances, SMI and SED, and it includes increasing the delivery of systems of care for children, youth, young adults, and families affected by SMI or SED. It talks about expanding transition age services, child trauma services, school-based care, efforts for young people who are at clinical high risk for developing psychosis, expanding the use of community recovery support systems such as clubhouses and other peer-to-peer focused support services, and of course suicide prevention. As many of you know, SAMHSA has funded several grant programs designed to improve life trajectories specifically for young adults 16 to 25 with or at risk of serious mental health challenges since about 2002. I'm excited that this learning community is available not only to current grantees but to all stakeholders working with young adults to achieve better outcomes. This learning community is one way to experience support and success while working toward sustainable positive change in your communities. Please use this platform to share your knowledge and learn from others. I encourage you also to invite your peers to join. All SAMHSA grantees on the call, please reach out to your SAMHSA project officers with any grant-specific questions. Thank you all for joining us today. The success of Young Adult Services and Support Learning Community will be enhanced only through your interest and participation. I hope you find it helpful as you continue your important work. Lastly, thank you to Johanna, Gwen White, and all the TA Network staff for sponsoring this learning community. Now I'll turn it back to Johanna. Thank you.
Diane, thank you so much for all of your kind words and for helping us kick off what will be a really great learning community. In the chat box, if you haven't joined us online in the virtual learning community, the enroll link is available for you to click. It's free and open and interactive for anyone to join. We'll be ending our session today with more details about next steps and events for you to join us within this learning community. This learning session and learning community are hosted by the National TA Network for Children's Behavioral Health, which is operated by and coordinated through the University of Maryland. Thanks to all the help we have on the line to make today's event successful from the university. All right, so what are we talking about today? Where are we going? Each of our learning sessions in this learning community covers a topic of interest to your community and is around an area to improve the system of supports for young adults of transition age. Today we're talking about a couple of things, particularly approaches to support suicide prevention work for young adults of transition age, and interventions and options within our service array via technology. We're going to be discussing the why of technology. Over and over again, we are hearing young adults demand that we increase our effective use of technology. Why is this? We'll discuss briefly today, and this will be a theme you'll hear us return to again and again throughout the learning community. We'll have an opportunity to learn from a peer community in the implementation of local keywords from the crisis text line, and have plenty of opportunities to have your questions be answered. And the goal of today's session is to really increase your understanding and your confidence in implementing a keyword strategy or similar effort in your community at this time. Our discussion and topic today is connected to the continued effort to bring awareness in May as Children's Mental Health Awareness Month. Our partners and communities across the nation have been working to increase awareness the entire month, and there is still work to be done. SAMHSA's national theme this month is Suicide Prevention Strategies That Work. There are many resources made available to you via the website links available on this slide here. Specifically, we share a link to several suicide prevention resources that have been curated by national experts, and we hope that you will learn and share and promote those within your communities. We also share a link to a series of highlights from communities just like yours who are raising awareness this month to share ideas for this year and future years for your children's mental health awareness work. Suicide is often preventable. By starting the conversation, providing support, and directing help to those who need it, we can save lives. A huge thank you for all of the work that you are currently doing in your communities to support young people and to raise awareness about important issues of mental health in your community. We couldn't do it without you, so thank you very much. I want to transition us from why we're here today to who we are and what we're doing. So we'll kick off with a poll question that's appearing on your slide right now. The question here is tipping us into use of technology. How effectively is your community or state utilizing technology as a communication and support strategy for young adults? Click the option on your screen that best responds. It fits your community, is the best response for your community, and you'll see results be broadcasting as you indicate them. So options include not at all, we have a basic start and could be doing more, we are using technology to communicate, we are using technology to offer services, or we are using technology to communicate and offer services. Awesome. So we have folks responding sort of across the spectrum. Really exciting to see the number of you that are using technology for both communications and service delivery. This is great. As you'll hear in just a moment, young people are really asking for technology to be a part of all of our work. We'll give you just one more moment to respond to the poll. Your responses help us know and understand our audience and be more reflective to your needs. Okay, great. I think we can close the poll now. There'll be additional opportunities to put input in through the poll throughout, so thanks for being present with us. So why should we invest in technology and other strategies like texting? We hear many different calls for inclusion of technology and particularly of texting, which is why we're focusing on texting as a method of communication via technology today. So what do we know? What does the research tell us about the field? We know that youth are using technology for information gathering and for communication essentially all of the time. We do look towards the Pew Research Center and their research on teens and social media use. If you've used resources and research from the Pew Center in the past, their sort of landmark 2016 data has been updated more recently in 2018 and confirms what I think we know and see happening in the world. Young people are finding ways to access technology and are choosing to communicate via technology, via phones and computers, despite the very real barriers that exist around access to internet and access to the devices themselves. Almost all young people are on these platforms and are using them many times a day. So we know it's where young people are, and if we want to be effective communicators, we want to meet them where they are. We also know from a review of the literature and research that youth are comfortable accessing mental health information and support via technology. So I think there has been a lingering question in the field if young people's desire to communicate and access information via technology would move into the mental health space, and that does seem to be the case. And so now we know that young people are using their devices to access that information, and they are choosing to use searches both for access to care as well as information gathering. What is mental health? What do diagnoses mean? What might these symptoms mean? They're choosing to access that information online. And we also know that young people are asking for social media platforms and texting as communication pathways to talk about mental health specifically. Youth Move National, the organization that I work for, was a part of developing a document called the Communication and Referral Pathways Toolkit for a cohort of SAMHSA grantees, and throughout that work did extensive collection of input from young people. And again, access to mental health information and communication pathways through social media and texting were requested. We know we're not the only ones hearing that messages from young people. And I'm hoping that you're actually hearing it from youth in your community. Specifically pulling out just a few quotes that we heard from that effort. Young people saying, having a number to call at any time or an email can also help young people feel connected, even if they never feel like they need to utilize it. Speaking to the importance that young people are really vetting the services and supports that are available to them for accessibility. Does it seem easy to access? Does it feel like someone would be there if I reached out, no matter the mode that I'm reaching out? And that's really important for young people. Also hearing the internet is a huge one. The first thing people often do is Google what they are going through. And this is a strategy I use in my own life, as well as a strategy I see young people using as well. If we go to Google and our search engine as our first stop for our questions, it becomes important. What are the responses? What do we find when we search those words? And I think we're aware of and working to more effectively maximize our ability to influence the search results that come up for young people. Thinking about how their queries online could be connected to referral and contact information to services and supports that are right in their own community. There's a really big potential there that we'd like to continue to explore in this learning community. And a final comment shared, young people seek instant gratification. Act as fast as possible and make a contact as soon as you can. And this is a quote summarizing a theme that comes up many times over specifically in regards to if a young person reaches out with a question or a query about a support that might be available, waiting a couple, 3 or more days for a response or a callback or many days for an appointment to be scheduled can often become a really big barrier for young adults to stay engaged in services, particularly when other parts of our life respond almost instantaneously via a text message or a Facebook message back to us. And so how can we think about really creating and designing a mental health system that is responsive to the expectations of young people? And technology is definitely a part of that. I'm going to pull us into one more poll question here if we can pull this up. All right, so we're pivoting a little bit from technology in general to our topic for the rest of today's call, which is the crisis text line. So our question is, how familiar are you with the support crisis text line offers? Not at all familiar, generally familiar, definitely familiar. That third one is for you confident folks who should probably be giving this presentation instead of me. All right, we have a mixture of folks who are familiar and who are new to this content. This is great. Okay, awesome. So I'll be giving a high-level overview of the crisis text line to get you set up for the best learning experience from Laura and the work that's happening in Ohio. All right, great. Tiara, I think we can close that poll. Awesome, great. Others on the call know what we're talking about. Okay, perfect. So what is crisis text line? That's where we're going to go next as our screen transitions here. All right. So Crisis Text Line is a service that's available anywhere in the U.S. via text message. And it is a system where any person, although it's designed for young people in mind, where a youth can text in to start a conversation to a 5-digit text code. And their text is responded to by a trained crisis counselor. It's actually a series of volunteers working across the country to always be providing a response to these text messages. And a young person can then engage in a back and forth text message, a conversation about whatever issue they're texting in about. Since the service launched in 2013, over 100 million and way above that by now, counting texts have been exchanged. There's actually a counter tracker on crisistextline.org so you can watch as the numbers of texts come in. And this is a service that has been overwhelmingly well received by young people and is, I think, really a key example in showing how ready young people are to accept and seek out support for mental health challenges via technology and via a text. So definitely an adaptation and a shift from our 1-800-CRISIS text lines that exist and are definitely a value add in our community. This is a text-based platform. Crisis Text Line has a very moving story, and the founder, Nancy Loveland, has a TED Talk that talks about the origin stories of Crisis Text Line coming out of work that she had previously done at DoSomething.org, another great youth-facing organization, and really talks about the approach of that Crisis Text Line uses to leverage the power of data. So not only are we offering a service to young people who are in a time of need, but we're also able to watch Crisis Text Lines work to collect and analyze the data that's coming in from those texts. And I'll talk about that in just a moment. So crisistextline.org is a resource for you. The content on the slides come off their descriptions, and it's easy to access more information, as well as numbers for you to share in your communities to make sure that young people know that they can access this support via text. And then we'll be talking more specifically about the keyword option, which is really what today's call is about. So in addition to the text message crisis response service that's being offered, there is a platform called crisistrends.org. And Crisis Trends is really offering a public-facing visualization of all of the data that's being collected via this text messaging service. And so Crisis Trends is an open, transparent data sharing strategy and is really about empowering our field, anything from empowering researchers to empowering our family members and school faculty members who are supporting young people to understand what's happening in their communities. And really the belief that access to this information and access to this type of data can empower us and prepare us to respond to the crises that will happen in the future. So a little bit later we'll do some screen sharing so you can see an exploration of how you might use crisistrends.org in your own work, but it's searchable by geographic location. So I live and work in Iowa and was able to look at all of the crisis data from Iowa. You can organize by type of crisis, by time of day that requests are being made to really get a picture to understand what young people are reaching out about for support in your community. It's a great platform in that it's well visualized, so even if you don't love data in the form of raw numbers and spreadsheets, the information is presented to you in a pretty usable format. And we're seeing young people who are using their lived experience in order to make change and talk about their lived experience and their own stories navigating the system, couple their stories with the data that's being shared on Crisis Trends in a way to make their message more powerful. So we encourage you to share it not only with your system partners, but also with your youth and family stakeholders in your community as well. And then there are additional open data collaborations available. You're going to see the data that's available in Ohio again in just a moment. So I am going to step back for a moment here and give the floor over to Laura to make a shift really to speak specifically about Ohio's experience. And as I do so, I would just remind everybody to drop comments and questions into the chat box so we can be responsive to your curiosity and learning areas throughout our call. Laura, can I pass over to you?
Yes, thank you. Okay, so diving in a little bit to our specific statewide partnership, it is called For Hope is our keyword for our state. And then, so this is a little repetitive, but so with our keyword, you can text For Hope. Anyone in the state of Ohio can text For Hope to the number 741-741. The number is the same all over the country. It's just the specific keywords that different states or organizations have that change. And one kind of easy way to remember the number is that it's all up the left side of your cell phone. So we usually tell people that, so it's easier to remember. And then their goal is that within 5 minutes, a live trained crisis counselor will respond to you. And then that volunteer crisis counselor moves you from a hot moment to a cool calm. So that's kind of their catchphrase. So why For Hope? So our keyword started actually in Stark County with their Mental Health and Addiction Recovery Board back in 2014 through a grant for our Department for Youth at Risk of Out-of-Home Placement. And again, as Johanna said, based on research, young people communicate via text more than other forms. So we weren't getting calls to our crisis lines like calling on the phone. So they had the idea of kind of forming this partnership so that there was a text service available. And then interest started growing across the state, and different people, different counties were interested in having their own keyword, and then we kind of decided as a state that it would be better to have a statewide keyword, which I'll talk about a little more, how that's more kind of beneficial on our end than having a lot of smaller keywords for different counties. So we brought our For Hope keyword statewide back in 2016. And one of the most exciting things that's happened recently is that we have a public data dashboard. So part of our, one of the benefits to our partnership is that we have access to our aggregate data. So it's all depersonalized. There's no identifying information or anything, but we are able to see our trends and our demographics coming in from these texts. So I will screen share now just to walk you all through. I'll spend a little time looking at our dashboard. Just one moment. Okay, is that good?
Yes, we can see it.
Yes.
Okay, perfect. Just making sure. So I'll start with, Johanna talked a little bit about crisis trends, so I'll start here because this is something that everyone can use, and it's for all over the country. So as you can see, this is the total for all texts, not just Ohio. This is all over the country. And then just a little visual. You can see, I think it's on anxiety and stress now. You can kind of see a heat map of which states have higher rates of certain things. So what does it say here? We've got, you know, as you can see over here, some higher in red is New York and New Hampshire and California. So you can kind of see by state what the rankings of those are, and then you can look at really any topic and kind of see that. I know for Ohio, we have a higher rate of texts about bullying. So it's just kind of something that you can, on your own time, look at and kind of gather some interesting information. And then, again, this is still just within the anxiety and stress code, and I'll talk a little bit about that later, but the way that they tag conversations is the crisis counselor is tagging each conversation as with the issues that are occurring. So if they have a conversation about anxiety or stress, they tag it that way, and that's how they kind of count those. So these are some co-occurring issues along with that. So relationships are a big one, depression and sadness. Also have isolation, self-harm. And then you can also see volume over time. You can see the day of the week that a lot of people are texting in. This goes across a lot of different topics that we have, and I'll show you this specifically for Ohio too. But we see a lot of texts in the middle of the week because we have a lot of young people texting in. You find that kind of school days are in the afternoons are kind of where more of a hot time for texting in about certain issues. And then again, this is the evening. You have more texts coming in around 8 or 10 p.m. And this is another, just one last kind of fun feature that the Crisis Trends website has. You can pick any issue, and it'll create a word cloud of common words used in conversations. So I picked LGBTQ issues because we have a lot of LGBTQ texters, and you can see this assortment of common words that are coming up in those conversations. So you see friends, you see parents, love, mom is a word that comes up in like a lot of these word clouds. So again, this is just something, it's for the entire country, and then there's a lot of different things that you can kind of look at on Crisis Trends. So moving over to our more specific dashboard. So through our partnership, we have our keyword, and then for anyone who uses our keyword, we're able to see that data. So we worked with Crisis Text Line over a couple of years to form this dashboard, and then myself and a few other people at the department have access to a more in-depth dashboard that we're able to have more filters. The public dashboard, you can only filter by time. So you can look at a specific period of time and then kind of look at how many conversations happened, or I'll go through and show you all the other things you can see. So since we began our partnership, or since we took it statewide in 2016, we've had over 22,000 conversations from over almost 11,000 texters. And then we've also had a total of 146 active rescues. So just to define that a little bit, an active rescue is any time that a counselor isn't able to de-escalate the texter's problem, and then they have to contact an emergency services. So it's the only time that this process becomes non-confidential, and that is just if they have to like send that off to 911 operators, basically, if the person is in immediate danger. But that is actually not the goal of the overall Crisis Text Line. Their goal is that catchphrase, hot moment to cool calm. So their goal really is just de-escalation. So they will work with the person texting in over their conversation of different, methods they can use to solve whatever crisis that they have. They'll give them ideas to, who can you talk to, like is there a family or friend you can talk to, and then they can also refer them to a way to find resources in their area. So that's just a little background on those active rescues. And those are on this volume trends. Those are those red dots that we see. So we have our all-time data on the left here, and then on the right is the last 30 days. One thing I'll point out is our all-time high was back in April of 2017, and that was actually, I think, a big peak for nationally. A few reasons for that are, one thing we have a lot of, we usually have a big peak in the end of the school year because we have a lot of young texters. They also saw a big peak after the release of 13 Reasons Why, and then they actually released a little like toolkit about how to deal with young people interacting with that. So another thing is that it's nice to be able to see this and then filter by time, because you can kind of see how specific issues affect our population. One thing for young people especially is there's always a peak after any kind of celebrity suicide. We see usually an influx of texts. And then again, at the end of the school year or maybe around the holidays, you'll also see a little peak there. So one cool thing that we're able to see is through a survey that they fill out at the end, 53% of our texters shared something with their crisis counselor that they've never shared with anyone else before. So that's kind of a testament to the benefit of this platform. So people using this service might not be comfortable telling someone in person or someone they know, but it's kind of they're able to kind of be anonymous. And then we also have, it's able to count our suicidal de-escalation. So this is a kind of new number that they started sending to us, which is the number of texters that had expressed a suicidal ideation and a plan and the means, and then the time frame to take their lives at the beginning of the conversation. And then the crisis counselor was able to de-escalate those high-risk conversations and keep that texter safe. So that's a newer number, but they have 281 that they've counted so far. So that's an exciting number to hear. And then we also have, we're able to see our volume by shift, and then our volume by the day of the week. So the shift is just the 2-hour shifts that the counselors use. So that's, again, we see most texts coming in the evenings between 8 and 10 p.m. And then on Wednesdays and Thursdays are kind of our bigger days during the week. So midweek again. And then we're also able to look at these specific issues that the counselors are tagging. So some new ones that they kind of added to our dashboard, they just redid our dashboard actually, and they added some new filters that we're able to see. So we're able to see social media is a new one, which I'm kind of excited to see grow and see kind of co-occurring issues with that, and if people are texting in about that. And then we also have school and finances. So this is just helpful in terms of seeing what specifically Ohio's texters are texting in about. And then on our end, we can also see where maybe our numbers are higher than other states. So we can kind of look where we need to focus our energy on. We also have a heat map where we're able to see by county who's texting in. As you can see, there's people from all over the country that are texting in. That kind of has to do with the way that they sort things with area codes. So people with out-of-state area codes could be living in Ohio and still using our keyword. And then we also get some demographic data. So the way this works is that it's texter reported. So at the end of every conversation, there is an optional survey that the texter can fill out, just kind of filling out their demographic data. And not everyone fills this out. It's about 10%. But we see it as being generally representative of who's texting in. So as you can see, we have a lot of young people texting in. 38.8% are 14 to 17, and then we actually have about 15% of our people are 13 or younger, and that's a growing number. And it's Ohio's 13 and under texters are actually higher than other states that have this partnership. So that's definitely a population that we like to look at. And then we're also able to see our race and origin breakdown. So one thing I'll point out about this is that we do have about 85% of our textures are white, and then about 10% black, and then 7% Hispanic, Latinx, or Spanish origin, and then some other categories as well. This is not necessarily representative of Ohio in general, but I will talk a little bit later about some of the challenges of kind of diversifying who is using this service and kind of advertising to get a more diverse population to use the service. But in general, Crisis Text Line nationally, they do have more women as well using it. As you can see, we have around 77%. And also we have a fairly high rate of LGBTQ plus texters, around 42%. And that rate is actually higher for our younger populations. And then this is another new thing to our dashboard is condition or disability. So we're able to see we have about 18% identify as having ADD or ADHD. And then another interesting one is our deaf or hard of hearing population. This is a service that obviously they're able to use just because it's via text. So we are interested in those numbers as well. So I will go back to the slideshow, if that's all right. I'm sorry, I don't know if it's just me, but mine's kind of frozen, I think.
You may want to try clicking on that Adobe icon from the bottom of your menu bar. It'll be like a green box, and it should pop up Adobe for you.
Yeah, I've got a little, looks like it's not responding. I'm sorry.
Oh, it's okay. No worries. So what we can do in the meantime to keep the presentation rolling, if you're able to pull up the actual PowerPoint, and we can just advance for you.
Do I have it up? Yeah, let me just pull it up real quick. Sorry about that. It's probably my technology.
No worries. Adobe is sometimes a little finicky, so.
Yeah, I have that swirling little circle there.
Yes.
Okay. Am I still sharing, or do I have to hit something else?
Nope. So we are back to the presentation, and just let me know when you're ready to advance the slides, and I'll move them for you. So right now we're still on slide 15.
Okay. So yes, you can switch to the next slide. So we focus a lot on how we can promote our keyword, because as you can see with our data dashboard, the more data that we get and the more textures that we get, the more valuable that data is. So some of our strategies for promoting that keyword are that our local boards can receive mini grants to create promotional materials and ad campaigns. We also do a lot of social media and social marketing related to Crisis Text Line to get the word out, especially to young people. And then you can see some examples on the right there of some of the materials that we've created. We pass out a lot of, pens and cell phone wallets and all that kind of stuff. We also have, this is an example of in Mahoning County, one of the boards used their mini grants to put advertisements on their local buses. And then we also have an area that's doing a lot of advertising in their local metro parks. So we do a lot of brainstorming of different things like that we could get to a more diverse population. We want to hit more racially diverse people, and we also want to hit more older ages as well as young people, although it's mostly young people using this service, but we do want, it's really for everyone. So some of our lessons learned, again, is the challenge of reaching that diverse population and being creative about how and where to advertise. We are also partnering a lot with local faith-based leaders and different local organizations. Schools really like to spread this material because it's just something easy they can do. I know Ohio State University is our local university, and they will put their RAs in their dorms will put up the crisis text line posters with our keyword and stuff in the dorms. So just kind of spreading the word with whoever you can. Again, more texters means better data for us. And then we've also learned the importance of partnering with public safety, schools, higher education, and faith-based communities. So we had, just as an example, we had one issue at some point with the active rescues that were being turned over to one of our region's 911 operators, and they weren't really understanding what crisis text line was, so that took some extra communication to them to make sure that everyone's on the same page and understands what the service is and where those texts are coming from. So I will, if you could move on to the next slide, please. I think this is okay, so this is a slide with our video, if you could play it.
Crisis text line is here to help day or night. Text 4HOPE to 741-741 for free and confidential support. Text with a trained volunteer to move from that hot moment to a cool calm.
That's just an example of we partnered with a social marketing group to make our some new videos and marketing materials to spread. We partner with the Ohio Association of County Behavioral Health Authorities. It's kind of our trade organization, and so they create all our materials for us, and then we are able to have them go to different community events and conferences and kind of hand out materials and spread the word. And then we also will do presentations on our data at different conferences as well to tell people kind of what is available to us. And then another thing that we're able to do is create specific reports. So we're able to look either by area code or by county or population by request if a specific board area wanted to see their numbers, then we could send that to them by request. So that's something that people get excited about, is just kind of seeing their numbers or what's trending in their area, and that kind of creates more investment at a local level. So, and then next page. And then these are just our resources. So the Ohio Association of County Behavioral Health Authorities that we work with has created toolkits for community organizations telling them how to advertise our keyword. Our crisis text line webpage on mha.ohio.gov has a link to our it has a link to our public dashboard, and then also other news stories or current things that are going on. There's a lot of research going on nationally with Crisis Text Line with their kind of machine learning capabilities. That's exciting. And you can find that more on crisistextline.org, but they will work with universities or other research institutions that to kind of look at their kind of word database of what different people are texting in. So there was a recent study that Ohio State University and then a couple other universities did on texts containing on conversations where there was child abuse disclosed in those conversations. So they're able to see not the actual text, those are all private, of course, but the general words that are associated with those. So there's some exciting research coming out, and then that machine learning capability is really exciting, and you can find out more about that on their website and then on Crisis Trends as well. So I think that's my time. Thank you very much, and I look forward to any questions you all might have.
Awesome. Laura, thank you so much for sharing all of that. So a reminder to folks that are listening that you're welcome to put any questions into the chat box, and we'll make sure that Laura hears them. I have a question, if you are ready, Laura, that came up as I was listening. I'm curious, so you talked about the specific data dashboard with Ohio data being publicly available. Can you talk a little bit about who and what type of stakeholders have been involved in helping analyze or help you think about what that data means?
So in terms of stakeholders, I'm just getting back on the Adobe. We actually co-sponsor this with our Department of Developmental Disabilities, and then I'm kind of the main researcher on our data. So we do find that sharing this data with any kind of stakeholders is important. I think just having it available on that public dashboard is exciting, because before that it was only by request. I'm trying to think if anything else. In terms of actual studying our data, we haven't done much of that yet in terms of writing a paper or anything like that. But we are just kind of able to see specific trends, which is really helpful for stakeholders. So I hope that answers your question.
Yeah, no, definitely. And I think you showed us really well, there's so much potential, right? So you have access, and it's deciding what to do. When it came up for me, because we've, also been involved in some responses to the 13 Reasons Why webinar. That's what we're on, Netflix series. And it's one of the discussion points that came up is that young people are often very aware of celebrity suicides or relevant television messages, but the general community may not realize that there's a response happening to that. So I'm really curious about how communities hear from their young people about identification of what was that thing that caused a spike in a certain type of request for help.
Yeah, Crisis Text Line nationally does. I think if you go to their webpage, you can look at their blog posts, and they also have a good newsletter that they'll send out. So for that, and then for other current things going on, they'll kind of send out what is trending or what's going on. I know they just sent one out a couple weeks ago for kind of finals week, where they said, the word finals is being texted in 15 times more than it usually is, or things like that they're able to learn from their data. But yeah, I agree. In terms of the 13 Reasons Why, there might be a lot of adults walking around not knowing that people might be just have been triggered by something, and then they're not sharing it with anyone, and then having this anonymous resource is kind of helpful to reach out to, and obviously a lot of people were doing that. So.
I'm going to jump in, Laura. We have a question about the volunteers who are staffing the text line, and what type of credentials they have and the training they receive.
So the crisis counselors are all volunteers. There is they have to apply and have recommendations and things like that, and then they go through a pretty in-depth training. I think it's 4 40 or 60 hours or something of training, which includes like cultural competence training and a bunch of other things like that. But they're also they're always overseen on their texting platform by a licensed clinician. So if they're in a position where someone they're texting with, they feel like they need additional support, they can basically on that platform tag in that counselor so that there's someone with more professional experience in the background to help out.
And this is Gwen. I know if people are very interested, if they go
sorry,
on...
I'm on a webinar, but yeah.
Oh. You have to put us on mute, Johanna. Okay. So I know that on the national website, if they go on that, there's very specific information about the training that the volunteers get.
Mm-hmm.
And how that, what's involved with that.
Mm-hmm.
So thank you, Laura. And Johanna has posted the volunteer process in the chat box.
Thank you.
I was impressed by what I'm now calling the 3 Ps as I listen, Laura, that promotion is important, partners are important, and then the power of the data,
Mm-hmm.
I think was really clear.
Yes.
Yeah, I'm wondering, we have a question and I'm curious about it too, what the steps are to establish infrastructure or technology like the For Hope Code in a state. Like where do you go and how do you indicate initial interest in that process?
So I wasn't actually here when they started all of this, but I believe you can just kind of reach out through crisistextline.org. We work directly with the people, their staff. I think it's fairly small. I'm looking at their website right now if there's a good contact, or I mean, if you're interested, you can always contact me. My email's on here. But yeah, there's a number of other states that also have a partner. So I'm seeing right now on crisistextline.org, they have a section, or just crisistextline.org/partners. So you might be able to look on there. I think there's a link that says how to become a partner.
Thank you, Laura, for offering all of your learning and
yep.
as a contact, for sure. I was curious in the marketing section, it sounded like you both have dollars that are available to local communities to do marketing there, but you also talked about social media marketing. Do you know if there is paid advertisement being used as a strategy on social media platforms for Hope?
Yes, there is. So that's, again, all done through AWACBA, our trade organization. So they do paid advertising runs through Facebook. And I think, I'm trying to think of what other ones they're using. I know they're using Facebook. They also, that video that we watched, they're running that on iHeartRadio. And then they also do local, like, broadcasting buys of like radio advertising as well. So yes, yeah, a lot of social media.
Awesome, great. Laura, would you have any sort of words of advice or a recommendation if anyone is from a state that's interested in starting this process, something you wish you would have known earlier on in the process?
I mean, I'm trying to think. Crisis Text Line themselves have been like very good to work with in terms of getting what we wanted on our dashboard and being responsive. I will say, again, that diversity thing that we were talking about, being able to maybe from the get-go advertise to a more broad range of people. And then also to really get those kind of partnerships. So if it was just us doing it, I don't think it would be as successful. I think, again, we have a lot of buy-in from schools and then from local boards. And, you know, when we go present at places, we still kind of get people that maybe don't know about it and they're excited. So it's really just kind of spreading it to different partners.
Laura, could you speak a little bit to funding and cost, or cost and funding? How those two things go together, I'm sure, and people are curious about that.
So I don't believe I'm allowed to share the exact amount that we pay contracting with crisis
Okay,
tech
that's fine.
Yeah.
But the budget line it comes from, or?
So again, when it first started, it was through a grant, and then now every year we have a yearly contract that we renew with them just as a department. And they're pretty flexible, I would say. If anybody's interested in it, kind of like reaching out to them and letting them know what you're trying to do. But again, we were one of the first states to have a partnership, so I'm not sure if ours is in line with how everyone else's have gone, but
sure.
All right. Well, Laura, thank you again so much for sharing all of your knowledge with us today. And really, the slides in and of themselves are a resource that I think everyone will benefit from seeing. I'm going to pivot us gently to some follow-up from this step and where the learning community is going from now. But for those of you on the line, feel free to keep sending questions in, and we'll make sure we get to your needs as they come up. So today is one step in a long discussion and an evolving discussion around technology. Technology will be a part of the way we communicate, we support, and we provide services with youth and young adults. And we are excited you're here embracing that strategy and looking forward to learn in community with you moving forward. Crisis Text Line is one resource and one opportunity to explore in your community and to discuss with your partners and stakeholders to see if this would be a good fit strategy for you. We also saw the power, and thank you, Laura, for that screen share, of data visualizations. And I encourage you to think about how access to data and visualized trends like this may empower and support your message of improving systems within your communities. And just a huge thank you for Ohio for paving the way as an early adopter of the local keyword and for being so gracious in sharing all of your lessons learned and the promotion strategies that you've been using. We're looking forward already to bringing additional peer voices onto future learning sessions, and we'll be excited if in the future it's any of you joining us to share the good work in your community. So just a big thank you to community today. This is one learning community, this is one step or part of a more robust learning community. There are many ways to engage with us. There is an online access process to get onto our virtual platform at Ideas at the Institute and this specific learning community, but it's quick and easy, your email and password, and then you'll enter into a sort of pathway of coursework that we've designed specifically for you. There are recordings up of foundational content and previous webinars if you're interested in hopping right in and learning. We are going to be continuing with new content and new opportunities really starting today. So every month there will be a monthly learning session like today, followed a couple of weeks later by an office hours. That office hours is a much more informal, small group discussion for anyone who joins us. You are welcome to bring challenges, ideas, questions to those calls. and we'll make sure that it is definitely a time to sort of process and further dive into the content that was covered on previous learning sessions. So in June, we will be looking forward to talking to you all about technology and crisis text line, and in addition to anything else you bring to that space. And we'll be bringing guest facilitators in as well. So our next call is June 12th for the office hours. Our next webinar will be June 28th, shifting a focus to policy. Very excited to have you all join us there. I note a couple of things. One is as we end the webinar today, there will be a survey for you to take. Please just give us candid feedback about what went well today so we can better design and improve the sessions to come, and that will start just as soon as the webinar ends. And then the second thing, all of our registration links and access to new content will be available to you through that learning platform. So really hoping it becomes a one-stop shop for you. Oh, and there, look, are the lovely links to both of the sessions that I just was mentioning. So we're excited to hear you in the rotation of sort of learning session like this, monthly office hour sessions, and then a mix of access to resources and peer-to-peer connections, comments, resource sharing that can happen at Ideas at the Institute, and specifically in the Young Adult Services and Supports learning community. We hope to hear your voices on the 12th and hear and receive your questions and comments on our webinar, Policy for Transformed Lives, a Framework for Policy and Systems Change to Support Young Adult Mental Health. And I'm just going to echo Laura offering herself as a resource. Gwen and I are here as resources and would love to connect with you on and offline. Our contact information is all on this slide, and we encourage you to reach out with your questions. As I mentioned just a moment ago, as we end today's session, there will be a survey that pops up, and we just would be grateful to receive any feedback that you could offer on today's session for the betterment of future learning. And I would offer a really big thank you to Laura for joining us today, and look forward to meeting everybody next time.
Thank you, everyone.
Thank you.